Have you ever wondered why trauma can be so sticky and hard to release? If so, then join us today as world-renowned expert and author of the Polyvagal Theory, Dr. Stephen Porges, helps us to better understand this complex topic. Dr. Porges shares with us the importance of our social engagement system, why trauma can cause someone to become immobilized and shut down, and how the polyvagal theory can help to rebalance our nervous system and heal from trauma. Hi, everybody. Welcome back to our show as we continue on with our trauma series. And today we have none other than Dr. Stephen Porges. So as we've gone through some of these past episodes, his name has popped up several times because his work was so incredibly influential in so many of the other guests that we talked to. So if you haven't heard of Dr. Stephen Porges, just go and check out the Polyvagal Theory. It's a revolutionary book that really explained what actually goes on in the nervous system for individuals that have gone through trauma. And it was actually very much appreciated by the mind-body community. That community really picked up this information because it gave validity to what they were experiencing clinically and why there was such a connection that when they would work with the body, that would actually help people with trauma or to release emotions that have been stored there for a long time. And so Dr. Porges's work really outlines what's going on in the nervous system, and then not just what's going on with it, but then how we need to intervene to basically get that system back online again so we can heal. So I was really looking forward to talking to Dr. Porges because his work has been so foundational for so many of the other leaders in the field of trauma. And so most of these other people were incredibly influenced by this work. And so we talk about a lot of different pieces of this, but we look at, why trauma causes the nervous system to shut down and prevent someone from healing. We look at how trauma interferes with that natural social engagement system. And when that happens, we can't actually interact. It literally is almost impossible to interact in our relationships in a way that is healthy and supportive. And so until we get that system back online again, we don't have access to it. So important, and this is why there's so many downstream sequelae to when people have experienced trauma. And for people to heal from trauma opens up their life exponentially because they literally can start to engage in a more effective way again. The other parts on it, we look at the hierarchy of the nervous system and then what shuts this hierarchy down. And when that hierarchy is no longer there, then again, it causes other troubles. So when that nervous system is dysregulated, it actually interferes with our ability to take cues from our environment, as well as taking cues from our own body intuition. So when this nervous system is offline, it's actually very difficult for us to even perceive safety cues properly in the world. We actually almost experience everything as danger cues. So again, it's hard to interact in the world when we are literally living in a state of feeling like we are in fight or flight or survival all the time. And then we also look at the importance and pay tribute a little bit to what we've learned from our ancient and indigenous cultures around the treatment of trauma. What you'll see is a lot of these old indigenous traditions inherently knew what to do with trauma. And we've actually learned a lot from those. And then Dr. Porges has just figured out the nervous system piece of that and how it all plays together. So we go through a lot of these different parts, and then we talk about what's required there to start to get the system back online and to heal from it. So I hope you guys really enjoy this episode. It was it was a pleasure to be able to talk to Dr. Porges, as I've been a big fan of his work for a long time. Now, another thing that has come up several times now, or at least from patients that have been asking me, is already people starting to ask me again, what is going on with the immune system? How can I support my immune system? Now, this has been going on literally for the last year and a half. There's been tons of talk about immune system support and whatnot just since COVID. But again, because we have less than about a month left in summer, we start to get into flu season, schools kind of coming back up. These topics all start to get people to think about immune system. They want to prep for cold and flu season, all that kind of stuff. So I want to mention a couple of episodes to go and check out that I think are really important ones that break a lot of information down. So I'll put these links in the show notes, but check out episode 53, which is called Tips to Stay Healthy and Reduce Stress for Our Kids. That one I go through a bunch of different information on. I think that's got a really, really valuable set of information to help with your children. Episode 31 is called Building Resilience in a Changing World. I think that's such a foundational episode for people because it gives an idea of not just what you can do right now, but what really needs to take place to build resilience. Because just because something is infectious or contagious does not mean that you're going to get it, or does not mean that even if you did get it, you're going to have a horrible reaction to it. This is all tied in with this concept of body resilience. And so I go through a lot of different pieces around what that means and what we can do to start to build that up. And then the other episode that is a really good one for as we move into sort of cold and flu season. I don't even really like to use the term cold and flu season because I think it all ties back to resilience. But a lot of times people's resilience goes down around that time for a number of different reasons that I talk about in these different episodes. But episode 11, cold and flu prevention, I do with a colleague of mine, Ryan Carnahan, and we just go back and forth and talk essentially what we do for ourselves, what we do for our families, what we've found has worked for a long time. And it gives you a lot of really step-by-step doable information that you can take a look at. Now, 3 keys to supporting healthy immunity. I think these are really important, and these are not necessarily ones that are always talked about. So number one, we need to be able to make enough of those first line defense cells. So these things like natural killer cells, T cells, B cells, all of these things are really important in that first line defense from getting sick. Now, what a lot of people don't realize is that we need to have a certain amount of stem cells available to be able to even make these different cells. Now, we can support that system in a lot of different ways, but one thing that a lot of times people aren't thinking about is if we have enough stem cells in the background, if we can increase the production of stem cells, those stem cells literally are these pluripotential cells that can become anything. So if we've got a good stockpile of stem cells as adults, we can use those to make different things that we need, different cells that we need. And this is why you will see stem cells can be used for tons of things. They will inject them in the top of the head to try and regrow more hair. They will inject them in joints to try and regrow more cartilage. You can use stem cells for lots of different things. This is a really huge area. But there are certain things that you can do to literally build the production of them yourself. And then if the need is there, and if the environment is right, then you can use them to make more of your immune system cells to support the fight against any kind of pathogens. And now the other part is sort of 2 parts, but it's around inflammation. And first, we need to be able to create a regulated, optimal, healthy immune response. Inflammation is not all bad. The problem is most of the time it's out of balance. So when a cell is damaged, there's a certain inflammatory response that takes place. And literally that cell sends out a signal for help. And we need to have that signal to then direct immune cells to that area to support the fight. Now, the problem is that if your body is already under too much inflammation, it's like too many calls for help everywhere. So it actually gets very confused. And so we need to have certain things in place that help to regulate and optimize that immune response so that we can contain the area and we can create a much more efficient approach to it. Okay, so we need to be able to regulate that immune response. The second thing is that, and a lot of people probably heard about this, but the cytokine storm. Now, COVID's brought a lot of awareness to something called a cytokine storm, but it's not just COVID. This can be for a lot of different things. A cytokine storm is when the inflammatory response becomes way too over-exaggerated. Now, again, a lot of this stuff would be things that I would look at in that episode 31, Building Resilience, because when those things are in place, you often decrease the susceptibility of even creating a cytokine storm in the first place. Building resilience means trying to get out of states of things like obesity and diabetes and cardiovascular illness and all of these different things. Like when we're already there, our immune system is in inflammatory states kind of primed for creating a cytokine storm if we get very ill. So having certain things in place to mitigate that cytokine storm or to quiet it down so we don't get such an over-exaggerated response is really important. Because what a cytokine storm does is it creates such an overreactive immune response that actually creates much more harm to the body than the illness itself. So we don't want to have that. We want to mitigate that as much as we can. Now, one of the products that I know of that supports all of those phases is C60 from Purple Power. So C60 effectively has these three different mechanisms that it supports. It fights inflammation, it regulates an immune system response, and it increases production of protective immune cells. So all three of those things it does inherently. The other thing that's really nice about C60 has also been shown in the research to have both antiviral and antimicrobial properties. So this could be a really supportive part of anybody's overall immune system protocol for moving into fall. So if you want to check them out, click the link below or go to the website at inspirehealthpodcast.com and click the link for 15% off your order. Just make sure you use the coupon code, all in capitals, Dr. Loken. That's all in capitals, DRLOKEN. All right, everybody, enjoy this show, and I will talk to you guys soon. Bye-bye. Hi, everybody. Welcome back to the Inspire Health Podcast as we continue on with our series on trauma recovery from surviving to thriving. And today we have Dr. Stephen Porges. And Dr. Porges is author of the Poly Vagal Theory. He's a distinguished university scientist at the Kinsey Institute, Indiana University, and professor of psychiatry at the University of North Carolina. Dr. Porges first presented polyvagal theory in 1994. Over the next 10 years, it was gradually adopted by a new wave of leading trauma therapists who found in polyvagal theory a clear explanation for the effectiveness of their body-based methodologies. For these new thinking therapists and the generation of clinicians who followed, polyvagal theory opened up the black box that is our nervous system and connected for the first time our sense of safety with behavior and communication patterns. Dr. Porges, what a pleasure to have you on the show today.
Well, thank you for inviting me, Jason. It's good to be here.
And I was excited to talk to you because what I've found is that in many of the guests that I've talked to in this series, the series is sort of a 15-part series talking to very different, diverse aspects of trauma with, we've talked to survivors of trauma, we've talked to different psychiatrists and different physicians, and we've talked to shamans, and we've talked to lots of different people to really get a broad picture of this. And I would say, for many of them, I think the work that you've done with polyvagal theory has been a big influence to many people. And it's actually shone a very bright light and brought more information around even how to understand trauma. So I'd love to start off by just getting your journey on how did you end up connecting the dots with the nervous system, and maybe explain for people that aren't familiar with it what polyvagal theory is.
Well, here's I would say, kind of the irony. I wasn't interested in trauma, but trauma became interested in me. It's kind of a weird trajectory. I was working in other areas of science. I was actually stuck on a problem with newborn babies that when they are under great risk, their heart rates often have massive bradycardia, meaning the heart rate goes very slow and their breathing stops. And of course, this is potentially lethal. And this has been assumed in neonatology to be mediated by a vagal pathway. But my research really was on a different vagal phenomenon, and that was heart rate variability, or more specifically, the respiratory pattern that you can see in the heart rate pattern, beat to beat heart rate pattern, because that's totally vagally mediated. So I was stuck with this paradox. How could the vagus, which was giving this beat to beat heart rate variability, which was protective, how could that be coming from the same system that created that lethal bradycardia and apnea? And I call that the vagal paradox. And then I sought about trying to figure it out. You first have to state the problem, and then you can solve it. And interestingly, within neonatology, they were describing these things as observables without really digging in and seeing what were the differences in the neural pathways. And when I started to really go into this deeply, and what some of this was my own research with actually animal models of blockades and surgery. Other research was in the clinical arena with neurosurgery and demise of people based on heart rate patterns. But I found an interesting literature, and the literature was in an area called comparative neuroanatomy. Basically it's the area that you don't want to go into. It's not very interesting, or for those in it, it's only interesting to them. But basically it looks at different species and looks at the neuroanatomy of that, and trying to develop an inference from the comparative species differences to an evolutionary model, because we really can't test evolution, but we can start looking at animals that evolved, or kind of like evolved from very ancient species and never really changed much. And what I found out was that in the transition from asocial reptiles to social mammals, this big transition which we're a part of, there were certain changes in the autonomic nervous system. It ended up getting a second vagal pathway. So the older vagal pathway, which is shared with virtually all vertebrates, is basically, when recruited in defense, shuts us down. We functionally pretend or death feign. It's not a conscious event. It's like a reptile or a snake not moving. Very easy for them because they don't need much oxygen. But when it starts dealing, when mammals do that, it starts creating problems. They start passing out or potentially falling, and it's potentially lethal for individuals. So it's in a sense, a system that's on board, but it's a last resort system. It's a life threat reaction. So I started to figure out that these two circuits, the one of a vagal circuit that was protecting and the vagal circuit that shut us down, were actually different neural pathways. And to make it very simple, the neural pathway that we have that protects us, interestingly, is linked to the neural area of the brainstem that regulates the muscles of our face and head, so that we are functionally broadcasting our bodily state in our voice and in our facial expression. And we're also stimulating our vagal regulation of our visceral organs through our social interactions. So what the theory ended up doing is elevating the concept of sociality or social behavior as a neuromodulator. And from any medical perspective, people talk about social behavior as if it's an add-on, it's fluff. But what this theory tells us is it's not fluff. It's a portal into regulating autonomic state and optimizing its function. And the older vagal circuit, when it gets cues from the newer one that we're safe and we can communicate, it does its job. But when it doesn't get the cues of safety, it can shut us down. And trauma, of course, is a history. When you study trauma, the first thing you have to do is separate the issue from the event, or the issues related to the event, and focus on the bodily reaction to the event, the personal experience. And this is critical because if the physiological reaction to the trauma is this shutting down, we know exactly where you are physiologically. And once you have that immobilization shutting down response, it's very difficult for the body to detect cues of safety in the world, because it becomes conservative, hypervigilant, and it misreads cues because it's reorganized to detect threat and not to detect safety. Anyway, that was the journey. And to my surprise, what I had discovered mapped into the personal experiences of survivors of trauma. And that's where I started to learn from the survivors about their personal journey. And their personal journey was, we could actually use the word dissolution, which is a word in physiology. It means evolution in reverse. And it occurs with, functionally, it's a word that was used for brain damage and brain disease, that under disease, we retract our newer circuits and use older ones. And this got applied to polyvagal theory. So trauma, or those who survive trauma, have experienced this dissolution, moving from newer evolutionary circuits to older ones, and finally shutting down and dissociating or freezing.
Okay. So that brings up a question then. What exactly is trauma, and what has to be in place for trauma to really get stuck? Even sort of the difference between like chronic stressors versus
Mm,
trauma,
yeah.
because I think a lot of times these things sometimes get lumped together, and they seem to be quite different in certain ways.
Yeah, I see what we're doing in both cases. We're falling into traps. You're using the word chronic stressors and trauma, and they're really outside the body. And what polyvagal theory says is, okay, you can use those terms in general,
Mhm.
but when you're talking to a specific client or person, those words are literally meaningless, The issue is under what conditions or contexts or situations does your body go into that most primitive shutting down response? So if your body detects threat at the level of survival or life threat and shuts down, you now are a survivor of trauma. If your body gets more locked into a fight flight where you become mobilized, or in the clinical world we say very tightly wrapped, hypervigilant, can't sit still, um, you might define that more like chronic stress, and that is the inability to relax. But don't separate, or and I would suggest not to separate those who are vulnerable to chronic stress from those who have experienced severe trauma, because frequently they'll be the same people. In a sense, people who have never experienced or haven't frequently experienced a physiological state of feeling safe.
Hmm. Yeah, well put. So then I guess maybe the question would be, what would have to take place for a certain experience to cause someone to go into that shutdown phase versus someone to be going into the
Yeah,
sympathetic dominant
yeah.
stage?
Yeah. Well, first of all, let's go back one point and let's talk about the word stress, and let's throw that out. And let's say that under certain situations, our nervous system interrupts or suppresses its homeostatic role, meaning it stops serving the organs and our health and now starts serving our survival. And the initial reaction of that is really to suppress this newer ventral vagal control, which is allowing our organs to function more optimally, and now shifts in a metabolic to a more metabolically costly reaction requiring the sympathetics. Now, the beauty of that, and I don't mean to say that as a sarcastic statement, is that we evolved to move from that state to safe states relatively rapidly. You think of a baby crying and going into tantrum, and the mother using her prosodic voice and gestures, and suddenly the baby calms down. We see this with adults even who get really upset, and then their close friends or spouses, and sometimes their dogs in proximity will calm them down. Their bodies feel safe with that individual, and suddenly the cues of safety are so powerful that they literally terminate the threat reaction. And this is really, again, the evolutionary history of social mammals. They had a portal that turned off their threat reactions. And that portal was what I call the social engagement system, which was the neural regulation, the muscles of the face and head. And a strong one from those structures happens to be intonation of voice. We were able to calm people down by our voices and by our gestures and facial expressivity. And this enabled basically relationships to occur. So your question really is, when is there a switch, I think you're asking, from a sympathetic dominant to a life threat shutting down response, which we would then, in a polyvagal terminology, say that shutting down is what's defining a profound sense of trauma, because the body gets retuned by going into that state. And the answer is pragmatic. Did the body in its own feedback loops experience the mobilization as removing them from threat? So it's not an intentionality, but it's a decision-making process within the nervous system. So if you fight or flee, is that sufficient for your nervous system not to shut down? But under overwhelming odds, so let's say that you're a child and you're being abused by an adult, the probability of going into an immobilization state starts to increase. And we have to literally think of the mouse and the cat. And where the mouse is doing fine if the mouse is in an open space. But if the mouse is cornered, there's a high probability the mouse will immobilize. And in a sense, that's the reaction that many people experience as their initial reaction defining trauma. What the body does with subsequent intrusions is its ability to modify its reaction to be less lethal. So if we shut down and defecate and immobilize, we could fall, we could get injured, we might not get enough oxygen to the brain. It's a profound change, and the body doesn't go back to that repeatedly because it's just not it functionally, it learns, usually learns after one or two trials. And what the body will then do is still immobilize, freeze, but use enough sympathetic tone not to hit the floor. And the individual will dissociate, go to another place. So we have to see freezing and dissociation as adaptive reactions to enable us to survive without the detrimental effects of passing out.
I think one thing that I think has been really beneficial with this theory is that for patients that have gone through that phase where they've gone into that shutdown phase. I know personally talking with different patients that have gone through that, they actually feel like in a lot of ways their body let them down and they're
Yeah.
actually very upset with their body. And one thing that I think this has really been helpful is it sort of shows that that's actually a survival technique that the body has adapted to over millions of years. So it's sort of less that the body let them down, but it was doing everything it
Yeah.
could to try and keep them to survive.
Yeah, I think what you have heard from survivors is accurate, and I've heard that. And by giving them a different narrative, they see the body as being heroic and not as letting them down. And this is important because when they feel that the body's let them down, their subsequent behaviors regarding their body is numbness, not to respond to the body's cues. And it results literally in a more progressive disembodiment, which functionally from a neuroanatomical or neurophysiological level means you're not listening to your feedback systems. And then you start getting all these peripheral disorders in which the organs are not functioning. And this is often called medically unexplained symptoms: irritable bowel, fibromyalgia, migraine. They're peripheral autonomic reactions. But what they're really telling the observer is that the feedback loops regulating your visceral organs, meaning your autonomic nervous system, is in a state of constant threat. And we have to turn that off. But since traditional medical models are, if the organ isn't functioning, you treat the organ. But a polyvagal perspective says the end organ damage is really the end of a long trajectory of a dysregulated neural regulation of the organ. And if you can see that dysregulation, which is what you start the conversation about in terms of talk about chronic stress results in a transitory, it becomes chronic after a while, uh, inhibition of the appropriate neuroregulation. But people should see that and they should then start to remediate that. And there are a lot of ways of remediating that in terms of safer context, different expectancies, cues of safety, breath work, many different ways to shift the nervous system or retune it from a nervous system in a state of constant threat to a nervous system of calmness.
Mhm. Um, when we talk about the autonomic nervous system, I know even in osteopathy, from a hands-on point of view, right towards the end, that was one of the last systems that we really worked with. And it was almost like once you actually learn this to work with this system, a lot of other stuff that you learned is not actually totally needed because you're almost working individually, symptomatically on things. But when you work with the autonomic nervous system, because it regulates so many things, when then that starts to get sort of balanced back out again, it just has such a dramatic ripple throughout the entire body.
It's a ripple that's not only the body, but the feedback from the body changes the mental perspective of the world. When your body, in a sense, is regulating and you feel safe, you become more optimistic and more spontaneously engaging with others. What is interesting is that there's a vague term floating around the medical community called dysautonomia, which is really destabilization or difficulties in autonomic regulation. And what you find is that this autonomia is associated with many chronic disorders. But what is also observable is that the impact or the observable dysautonomia is often linked to a trauma incident. So you start getting diagnoses that uh, are real, meaning that there is damage or there can even be a genetic predisposition. But the traumatic experience becomes the potent trigger that creates sufficient destabilization in autonomic function to now basically foster the symptoms.
Steve, when the system is when that social engagement system is shut down, what are some of the long-term sequelae to that? Like how does that affect the person in their relationships? Like what's how's that going to show up for them? Because part of it is once these things start, then they tend to just create more and
Well,
more problems. So,
okay, so we evolved to be co-regulators, not self-regulators, but co-regulators, which means that we send cues to others of safety and they send back cues back to us. And we like that. In fact, even when we play, we're using voice and face to ensure that our physical movements aren't interpreted as being aggressive. So we realize that social engagement with a word or intonation of a word and a facial expression, and even the reciprocal aspect of listening and not talking all the time, uh, creates part of this regulatory capacity. These are neural exercises. So if the social engagement system isn't working, you will be interpreted by others as being rude, not nice, arrogant, angry. Any type of negative term will be just attributed to you, because our bodies are, when we engage, our bodies anticipate a reciprocal engagement. And when that doesn't occur, we get a bodily reaction. So our nervous system is attempting to detect this outside of awareness. And I call this neuroception, to give it respect without intentionality or awareness. So our nervous system is detecting cues of safety or reciprocity from others. But what happens when we don't get that? We get a visceral bodily reaction of which we are aware of. So it can be, and when we get, in a sense, an awareness of, let's say, that we've been socially injured or dismissed or not respected, we become reactive, and now our face represents that, and our voices change. Now, frequently, our neuroception is detecting cues that are not from the other person, but are from the environment, like noise, rumble, or where our bodies may start getting more threat oriented, and we may be misinterpreting what the other person is saying, and we maybe start speaking without intonation and not looking at the other person, or using our cell phones, which is another major issue of which people use, because they use words like you're addicted to social media. But really what we're saying is people are anxious. They haven't the skill set. They haven't had the opportunities to develop a skill set to co-regulate with another. And they have obsessed literally with co-regulating with objects. And co-regulation with objects doesn't calm us down in the same way that co-regulation with people does.
that's actually fascinating because that I think about the kids. I mean, I think about how many kids, particularly I see sort of like boys, particular, very addicted to technology,
Mhm.
and you're seeing a very different change with this social engagement. I mean, they feel like they are engaging socially through games and through these because everything's now
Yeah.
this on. So how is that different from actually
Well,
engaging in person?
all you need to do is look at their faces while they're doing that.
Hmm.
When you look at people looking at each other, you see a lot of activity in the upper part of the face, the orbital muscle around the eye. It's called the orbicularis oculi. You see that, and that's where you see exuberance. And that's where, since people feel, oh, I like that person. He has a nice smile. They're not talking about the smile down here. They're talking about up here.
Right.
And that people feel that there's an accessibility when that part of the face is working. But if you watch kids playing or using the smartphones, the faces are flat. So there's in a sense a partial disconnect, even though they are, quote, socially connecting. So we now have social media, which is not really social. We have game playing, which is not really playing, because playing historically has implied reciprocity. Go out and play with your friends. It's not go out and parallel play, it's go out and interact with others. So our nervous system always like that, or even like when we have a puppy or a kitten, we play with it. And what is play? It's reciprocal. the animal is playing with you as you play with the animal. You're reading cues back and forth. Those are important neural exercises that our society has minimized. We need time to have reciprocal play.
Hmm. So when the social engagement system is working optimally, is the where's sort of the range then for normal social behavior? Because you definitely see a range between people that are very introverted versus extroverted. And I'm kind of, when I was reading through the book too and learning more about it, I was thinking just in the big picture, like, I mean, I've known people all over the map on
Yeah.
that. So when does it become something to look at that might be not beneficial versus just within the range of normal behavior?
Well, first of all, there is going to be a range. And second, part of that range is going to be a function of the state of their autonomic nervous system. So we're already creating two ranges, right? We're creating a range that we think is more temperamental or genetically determined. And then we're talking about more state-driven one where we have it fluctuates. I am actually over time, let's say over the years, more cautious about thinking about temperamental features. I much rather talk about optimizing what we have. It's always like saying,
Yeah.
oh, you're saying, well, I've known people and they basically were not very social, interactive, or regulating, and they would have to go to their room or by them space. They were titrating how much time they could. And I think that's totally accurate. There are people like that. However, I am not so sure that their autonomic nervous systems could be retuned to have a greater range of experience. And once we start understanding this, so if you describe people, and I would ask you another question, tell me about other clinical features. Do they have irritable bowel syndrome? Are they
Mhm.
muscularly tightly wrapped? Does noise bother them? What does their voice sound like? And what you start getting is a profile of a social engagement system that is retracted in the consequences of that retraction on autonomic function. Now, the question is what happens if you now try to bring that system back on board? What are the consequences?
Mhm.
And I'm still sitting there trying to see what happens. And, I get reports back, and the way that I get reports back is I developed an intervention that functionally stimulates the social engagement system, downregulates defenses, makes the body calmer. And when that occurs, there's far more spontaneous social engagement behaviors. And we start seeing things like reduction of auditory and visual hypersensitivities, and the ability to extract human voice more accurately from background sounds. And irritable bowel and other medically unexplained symptoms just kind of like getting better or disappearing. Not that this is a causal effect uh, of the intervention. What is happening is that the autonomic nervous system is getting retuned in a more optimal way. And I think if we start to kind of carry that metaphor with us and say, how can we optimize the functioning of our autonomic nervous system to support homeostatic function and increase the range in which it is homeostatic, meaning may enable us to be more resilient?
Mhm.
I see no downside unless you're a warrior, and you need to be hyper vigilant. But even in that case, your body will get damaged if you don't have opportunities to calm it down. So the issue is not that we give up our defenses, but we give up our defenses in safe social contexts. And that's the neural exercise. The neural exercise is not that we give up defense. And this is where I basically get into some, I would say, uh, uh, ethical, emotional, and theoretical conflicts with different treatment models. Because if the treatment model is pharmaceutical, you're basically going in and saying, I'm changing the system. And what polyvagal theory says is, can I use neural exercises to increase the range and resilience of the system? It's a different strategy.
Yeah. Well, and I think about it too. I think ultimately, if that social engagement system is on, you're never really giving up defenses because that system can switch very quickly
Yeah.
in and out as needed. I actually think you just are in a state of being able to interpret your environment more optimally
Yeah.
either way.
I agree, but let's do a little qualification of that very optimistic and positive statement. And that is if you downregulate or retract or withdraw that social engagement system for too long a period of time, the organ is not flourishing. The organs that have now, you're blocking the feedback loops. Now you're optimizing metabolic outputs to run, flee, fight, and be aggressive, but you need to, in a sense, be aware of what's happened to your body during that period of time. And this is, again, within our world, what people do is when they suppress their social engagement system, they quote are working hard or stressed out. And what do they then do next? Do they relax and replenish that system and allow it to flourish again? Or do they work even harder? Do they raise the incentive to withdraw that social engagement systems? Or instead, do they say, I can sit at this desk for another 4 hours, and if I have to stay up all night, I will? And
Mhm.
in many cases, people do that. And then you start affecting the system in a way that it doesn't have the same resilience to come back into social engagement.
Mhm. Mhm. Where is the role? And I want to get back to the safe and sound protocol in a little bit here, but because I want to understand that and share that with the viewers. Where is the role of the body-based therapies? Why? Because I know a lot of therapists that incorporated a lot of body-based therapy really grabbed onto the polyvagal theory because it made sense for them for what they were seeing clinically. Can you share from your perspective why body-based therapies play this other role outside of traditional psychotherapy alone?
Yeah, but within the world of trauma, and you've been investigating that, inviting people to talk about it, the real assumption now, and this is I would say, a revolutionary assumption that has followed a transition over the past couple of decades, is that trauma resides in the body. But we're going to redefine that from a polyvagal perspective. We're going to say that the body is sending cues to the brainstem, and the brainstem it's in the brainstem that the awareness of that trauma, not awareness, it's a neural awareness of that trauma resides. And if we can, in a sense, give cues to the brainstem that it's a safe environment, then the regulation of those bodily organs change. So, in a sense, you're dealing really not merely with a somatic therapy model or somatic model. It's really a bottom up and top down model because the somatic therapies are doing both. They're using bottom up to give cues to the narratives, but the narratives are now top down. So it's, in a sense, they're trying to stimulate, from my perspective, they're stimulating the feedback loops that have been dormant, which is really the progression of what trauma does to the body. It turns off its feedback. It makes a person unaware of their bodily organs, unaware of the pleasure of their body, and also unaware of the pain. It's turned off. And so the issue is bottom up and top down. So what polyvagal theory says, yeah, they come together in the brainstem. And in terms of the regulation of the autonomics, which is really where our focus has been on, most of the fibers are going to the brain. It's like 80% of the, especially in the vagus, 80% of the vagal fibers go to the brain and only 20 go from the brain to the organs. So, and when that information, when it goes to the brainstem, affects portals of communication with higher brain structures. So what that means is that when your body isn't feeling good, it's sending cues to the brainstem, and the brainstem is turning off accessibility to higher cortical areas where your decision making occurs. So we need to think more in an integrated one nervous system model of both body and brain. And then somatics become a natural part because that's how we can get into the brain easily. We can create patterns of stimulation.
So when someone is engaging in whether that would be vocalization or singing or breath work or something along those lines, because of the distribution of the vagus and the sensory fibers, they're going to pick up that sort of sensation that is sort of calming for the body. And then that sends a message to the brain that lets the brain know that we're safe.
Yeah, but you're really saying even more than that. When you sing and when you listen and breathe in different ways, you are functionally performing a active neuroregulatory function. You are you're actually increasing the stimulation of the fibers going through the vagus. You are doing the calming yourself. You don't need an electrical stimulator. So slow exhalations, modulated vocalizations. First of all, remember that the nerves controlling the larynx and the pharynx, which gives us intonation, they're vagal nerves. They parallel the vagal nerve going to your heart and your other visceral organs. So when we are uh, talking with a prosodic intonation voice, uh, we are literally influencing our organs. What I like to say in a simple way is we're broadcasting the state of those organs. But if we want to get even more sophisticated, we're not just broadcasting the state of those organs, we're also influencing the state of those organs. So you'll find that many people like to sing, people will play wind instruments, people will do slow exhalations. These are all powerful portals into calming our autonomic nervous system down through vagal mechanisms. And then you'll have people who will even like rub their earlobes
Mm.
or rub their forehead or rub their neck. They're literally performing stimulating the afferents that are going into that brainstem area that regulate the vagus. So, if we watch what people do, we see that they are trying to regulate their physiology. What polyvagal theory gives us is a way of decoding that and not in a sense telling people to break habits, but trying to understand that their body is requesting stimulation through those pathways and to teach them different ways to do that.
Hmm. Well, it's interesting. I remember my wife and I were at a course with Dr. Bessel van der Kolk, and he was talking about when there was the tsunamis in Thailand, and they sent a bunch of people out to try and help with the trauma. And he said what they found was that they learned a lot more than what they were going to try and help them with, because within their culture, they had a lot of the foundations to deal with trauma very effectively. They had community, they would do singing, they would have a lot of the processes. And it reminds me too, we recently did, for the series, I talked to a Mohawk elder, with all of the stuff that's been going on in Canada here, I mean, in the US as well. But and one of the things that he had mentioned for what was required to heal, he goes, pretty much all of the healing would take place within community and ceremony, and that those
Yeah.
two things were necessary for healing to occur. From your perspective, then, what's sort of essential that needs to be in place? I know this is going to be individual, but in general, what are some of the factors that need to be there in order for healing to really start to
Okay.
take place? Because it seems like when they are in that dorsal vagal dominant place, when they're in that shutdown mode, it can be a challenge to try and get back into those other systems, because it's not sort of designed to switch very easily back and forth.
Correct. And I think we're going to start off with something we haven't discussed, and that is being a good witness. And we're, of course, in a society that sees damage and wants to fix it. So even within the trauma community, you have people who say, the person's been injured. We have to get retribution. We have to fix that. We have to think of the survivor of trauma from a different perspective. That is a person who wants to have their voice back again. And that voice is often going to say things that make others feel uncomfortable, and they don't want to do that. So when people say, I need to now get retribution, I need to help you get that, that's not what their bodies are saying. Their
Mm.
bodies are saying, I want you there unconditionally. I want you to listen to my voice. I want to be heard. I want to be real again. So the first part of this is, what does it mean to be a witness? What does it mean to be unevaluative, not to evaluate the individual? Because as we evaluate them in any way and say, oh, that was horrible, we're also shifting their body back into a state of threat. So we want to understand that our words, even in terms of therapy, we might say, well, we need to get this assessment or this test. Tests and assessments in themselves are threats. Our bodies are always being threatened. When we go to medical, for medical care, or when we're in education, we're always being assessed. We're being evaluated. We need to be better witnesses, and we need to be a witness that says to the individual, This is a shared journey, and I'm here with you for that shared journey. So the first thing is to remove cues of threat. And what I'm saying is it's not as simple as you may think, because even the well-meaning therapist may be asking questions of evaluation that are triggers of threat. The other part is when people survive trauma, their bodies are tuned to detect threat. And if you do anything that removes that threat sensitivity, so in a sense, without doing the appropriate work, trauma work. So let's say that we now give cues of safety, and reflexively, the trauma survivor's body becomes accessible. That momentary accessibility is interpreted by that nervous system as vulnerability. So that's why trauma-informed therapists understand that, and they literally titrate and move very slowly. So if you have now feel accessible and that's vulnerability, stop what you're doing and let's talk about what you're feeling. So what the strategy is a re-embodiment in the body of understanding the cues that your body's processing, and basically a re-education or retuning of the nervous system that those cues are not going to be harmful. And sometimes it's very time consuming to do this.
Yeah, Pat Ogden talked about that a little bit too, and I know Peter Levine's spoken about that a lot with the titration and sort of
Yeah.
allowing yourself to go in and then pulling back out, and when it feels
Yeah.
like it's too much. And
Yeah, both Pat and Peter are fantastic, and of course they're innovators, and I've learned a lot from watching them with clients, and in a sense, giving agency to the client to create the titration. So, like, there's a video that Pat uses, and I actually borrowed it. It's where she's in a clinical setting with a client, and the client's hands are gnarled, lots of tension, and she's on a chair and she just moves further and further away. Suddenly the body of the client relaxes, the hands go up, and then the camera pans and she's like 30 feet away. And the client says, come back. Now the client is now becoming
yeah,
accessible and in control. But it's this whole notion of the client's body understanding that her presence, her proximity is not a threat, and that the client has the agency to control that. Peter does similar things, and it's very important. And what you see from their clinical work is that the body almost miraculously learns very rapidly that it's not dangerous.
hmm yeah, I think it's a actually really beautiful approach when you see it happen like that, and it's such an organic way. I think it's really quite beautiful. Steve, you had mentioned the heart rate variability earlier, and I'm curious about this because I know heart rate variability has been used in a lot of ways on, I would say, kind of under the guise of sort of regulating the autonomic nervous system to some point, or supporting vagal tone. Um, what is your perspective on that? Where does that play in regulating the nervous system? And is it actually beneficial when someone is in that shutdown mode? Because there seems to be like, is that an excess of almost that system, or how does that
No,
work?
so once you start essence, embodying polyvagal principles, you realize that the shutdown is vagal, but
Hmm.
it's not the respiratory signs arrhythmia or heart rate variability. It's not that component. When you get more of the respiratory signs arrhythmia component in the heart rate variability, it basically starts to take charge. It's I view it as both the choreographer and the cheerleader. In a sense, it basically gives permission to these other parts of the autonomic nervous system, the sympathetic and that dorsal vagus, to join in the party, so that meaning that it keeps those systems out of defense. So you have sympathetic excitation with this ventral vagal, which is part of it, is this respiratory sinus arrhythmia. You call that play. You're in control. Now you're seated with a loved one and their bodies conform, or the baby and the mother conform. That's immobilization without fear, and that's social engagement with cues, sometimes like words or songs, and bodies just comforting. So it's not, it's a hybrid in which the ventral vagal social engagement system now tells these other circuits, do your job, but do it in pro-social or positive or homeostatic way. And the dorsal vagus is critical for our appropriate homeostatic function. So we don't want to minimize its importance in our daily health. It's when it goes into defense that we're in trouble.
So essentially, as long as the treatment is geared around getting that social engagement system back online, then that gets
Well,
everything else more or less starting to work
right.
properly.
So if you deconstruct what Peter and Pat do, they're dealing with the social engagement system. And my colleague Deb Dana, who basically has developed a polyvagal informed therapeutic strategy, uh, she doesn't even talk about their trauma histories. She talks about their physiological feelings. So she literally, her therapy is take them on a journey of their own body. Do they feel comfortable in it? And once they feel comfortable in it, they can deal with whatever you want to talk about.
Mhm.
But, and I think the issue is, I think this is I would say one of the powerful messages of polyvagal theory, and that is a physiological state is extremely important in how we process our bodily feelings, our psychological feelings, and the stimuli coming to us in the world. And if we are aware of our physiological state and it starts, in a sense, being able to be, let's say, regulated over a broader range of levels, then we're resilient.
Yeah. And coming back to the safe and sound protocol, I'd like to understand how is that assisting getting back into that that social engagement system, and what happens to that sort of cycle with muscles of the inner ear and hearing when people are in that other response, that
Okay.
shutdown phase.
Okay, when they're in the shutdown phase, the structures, let's say when they're in any form of defense, so let's basically cluster both a
Mhm.
sympathetic and even a dorsal vagal defense response, because dorsal vagal uh, defenses may not have a consciousness or the same consciousness as a sympathetic defense response. Uh, but let's ask the question, what goes on with the middle ear structures and what are they? The middle ear structures are the smallest bones in our body, and they're regulated by the smallest muscles in our body. Interestingly, when mammals evolved from reptiles, and the middle ear bones broke off their jawbone. So it's a basic phylogenetic transition marker we can find in our uh, in the fossils what is a mammal versus a reptile by whether or not they have detached middle ear bones. So why is that important? Well, it's important because that became a portal for mammals to use vocalizations to broadcast their physiological state. Basically, it's the foundation of social behavior. And the vocalizations were really broadcasting whether they were safe to come close to. So this whole system of detecting certain features of vocalization as safe, dangerous, or life-threatening is the history of mammals. But what we have to understand is that in certain frequency bands, when we start to listen to them like a mother's lullaby, our muscle tone to the middle ear muscles increases. And in increasing the muscle tone, the eardrum literally gets tighter. And that starts to dampen background sound. So now we can focus because we're hearing is being relatively louder, the frequencies of social communication. And once we do that, we start giving up our defenses. We start getting out of that physiological state. Let me shift it into another type of metaphor. When we stiffen that eardrum and tense those middle ear muscles, the brainstem structures that regulate the vagus are communicating with the muscles of our face and head, including those middle ear muscles. And in a way, we are stimulating the vagus indirectly. Just like if we were rubbing our forehead, which has a trigeminal afferent, it
Mhm.
doesn't go directly to the vagus, but it goes to the same area that those middle ear muscles go, and that area goes to the vagus. So this becomes calming. These are afferents in the ear from facial, vagal, and trigeminal, and they go to the same brainstem area, and they then go down through the vagus. So a lot of things that we're talking about in terms of indirect, we're talking about non invasive vagal nerve stimulation are actually going into this area, which is called the ventral vagal complex, which is the area of the social engagement system. So even our smiling is doing the same thing, and our singing is doing the same thing. We're
Hmm.
sending cues. And what Peter does, which is make sounds like ooh, vibratory sounds of the oral motor area, they're vagal nerve stimulators. They're going into that ventral vagal complex. So the issue is the you can do this acoustically, you can do this tactily, you can do this breathing wise, you can do this with vocalizations. The safe and sound protocol basically I view as a stealth intervention because it's passive. And you don't, the compliance is merely put the headset on and listen. And you then see what happens. And then tell me what you're feeling or what you're experiencing.
Hmm. Well, and it sounds like it plays specific. How does it actually work? So when someone's actually using it, how would you explain what's going on with it?
Well, it's functionally, I metaphorically call it a treadmill for the middle ear muscles. It's unlike a vagal nerve stimulator, which I view as a prosthesis. In a
Gotcha.
sense, replacing part of your feedback loop. The safe and sound protocol takes a different strategy. It says, can I retune the neural regulation? Can I exercise the system so that the system itself can take care of itself? And so what it's doing is it's over the 5 hour, it's a 5 hour program. And it started off as a 1 hour for 5 consecutive days, but we'll talk in a moment about what happened when it got adopted within the trauma community. But over those 5 hours, the frequency bands that are being modulated increase. And it starts off with a very narrow frequency band, which you don't really need middle ear muscles to get the sounds in. And then through the gradual transition, your nervous system is functionally reaching for those sounds.
Oh, okay.
And so visualize the bandwidth going back and forth, and but a very slow rate. As it gets larger, we start making more contact. And as the frequency band gets narrower, it's like the voice is disappearing and there's a little bit of hesitancy. But then when it comes back, you get feelings of exuberance. But over days or over hours in the program, the frequency band increases until all the frequency bands necessary to understand human speech are included. So when it got adopted by the trauma community, and many trauma therapists are using it now, then I start to learn a lot, because I had assumed that it was a stealth intervention and just go through it and listen. And I had, in a sense, had no counterindications from the kids who had been using it before, other than, occasionally a little bit of anxiety, but nothing, I mean, like 10 years of using this in
Hmm.
laboratory research, saw nothing that was unusual. But when it started being used in the trauma community, we start to get a feedback like a destabilization, very anxious. And what I started to realize was that the cues of safety for a survivor of severe, or let's say complex trauma, was a trauma cue in itself, because cues of safety were really trauma normally frequently occurred, but violation of trust with someone that was close to them.
Hmm.
And now, what is the safe and sound protocol doing? It's giving a physiological feeling of, let's say, I would use the term distilled essence of trust. So the
Wow.
body now goes into the state of trust. The physiology now responds to that. And then the uh, nervous system says, when I was there last, I was injured, and rapidly gets
Right.
destabilized, and I got to get out of here. And we saw this happening. And then it really, to me, it was very disturbing, because I follow that mandate, do no harm. And I don't like people not, thriving for things that I develop. But the insightful trauma therapist said, aha, this is a portal that will accelerate treatment. So similar to the models that both Pat and Peter use, the trauma therapists start to titrate with it and get the feedback and expand the duration that people would listen. And the feedback was that it accelerated their therapies drastically, that they became, in a sense, more they became re-embodied quicker, and the therapeutic trajectory was greatly accelerated, which made me feel good.
Nice. That's exactly what it was making me think about was with particular when we did a course with Peter, and it was the undulation,
Yeah,
and the slow titrating. The way you were describing it sounds like that's very much the same process, just in a
yeah,
in a different area.
yeah. And somatic experiencing practitioners, I think there are over 100 who are now safe and sound trained because it fits very well within their
Hmm.
model.
Yeah, yeah. Well, and sort of last question here, Stephen, is the this goes beyond just working with trauma. What I think is really fascinating with the work that you're doing is, and correct me if I'm wrong, but I would say part of the belief, it seems like, is that if that social engagement system is working properly, then our default, literally as a human species, is to be caring and loving and considerate and altruistic. I'm wondering if you can just shine a
Yeah.
bit of a light on that, and what the potential could be when people
Well,
start to really get that online.
I just rephrase what you said. So I think it really tells us what the core of human, what the core of being human is. Just as I think trauma also teaches us what the core of being human is because people have lost certain things. So you have this notion. Does the trauma world tell us? It says that people have not lost the intention of co-regulating or being safe in the arms of another, but their body can't do it. Their nervous system won't allow it. It doesn't give them permission. They retract, they become defensive, but their intentions are still there. So we know that's part of it. We know about purpose in life. We know about optimism. All these things are linked to this autonomic nervous system. We know that physiological function, even COVID reactivity, is linked to physiological state. So in a sense, COVID long haul is functionally a retuning of the autonomic nervous system, and not to think of it as something that COVID is doing outside that. So in our research, we're seeing that the mediating effect of autonomic state is powerful. So polyvagal theory says really that we are a loving, compassionate, benevolent species, and spiritual, but only when we're not in states of defense. Now, what does that mean? It means that the main agenda for human society is to remove threat, but that's not enough. So have focused on the removal of threat without a discussion of cues of safety. It's like uh, bombs will keep deterrence, or schools can have metal detectors, and principals can carry guns. This is all about threat, but those dealing with with external threat has also resulted in cues of threat and not cues of safety. So I'm not against removing threat. So let's start there. But the issue is we have to be much more cognizant of our body's need for cues of safety. And when our bodies get cues of safety, we become a different species. We become a generous, benevolent, caring group.
Mhm. I think is beautiful, and I think that it definitely opens up the potential for. I mean, I think if more and more people keep working towards that, if that becomes a goal where they want to get that
Mm.
online, that there's, I mean, to me, it feels like the research around this has blown up over the last 5 to 10 years substantially. So there's lots of information on there on how we can actually train our bodies to connect back to that
Yeah.
system.
Let me give the caveat to all that. We live in a challenging world.
Hmm.
And so, I'm still an academic, even though I'm not a full-time academic anymore, but I've been academic as a faculty member for over 50 years. It's a long time. And I would say that academics are far from safe environments. And I think work environments are also not safe. So we realize that our society is tuned to be evaluative, and in being tuned to be evaluative, we have lost sight of the intuitive desire to explore and create, which is in many of us. And when we feel safe, we feel bold. And when we feel bold, we are the explorers. But if we keep people feeling under threat, that boldness and that exploration isn't going to be expressed. So we have to understand there's a titration of society. I'm not saying that everyone should be empowered to be bold and create, because everyone doesn't do that or can't do that. But we have to enable different pathways for people to, in a sense, transform and to actualize who they really are. And the final word is, I think we really are, as a species, a remarkable, benevolent, and compassionate species.
Hmm. Well, and I think on that note too, it's a I mean it's a tricky dynamic because for the most part, I would say the world at large, it's a lot easier to get a dose of something that's going to rattle you or shake your world a little bit or put you more into a fear reaction. I know personally, even over this last chunk of time, something that's probably been the most beneficial if that I found for people if they can do it is to me and my family, I'd say it's like to get into nature. It's like when you can disengage and get out into nature and away from a constant barrage of just um, I mean, it's tricky. You turn on the media, even prior to everything that's gone on the last year and a half. I mean, most of the news and stuff is it can grab people in a lot of ways. So there's a balance between, I think, knowing what's going on, understanding what's happening in the world, but then finding ways to reconnect to something different. I mean, for us, I know anytime you can get into nature, I almost feel like it just naturally has this way of settling the nervous system.
It has rhythms. We're feeling the
Hmm.
rhythms, and it's living here in front of the ocean or by the side of the ocean uh, enables me to feel that. And being relatively isolated for the past, I guess it's 16 or months
Yeah.
or so, um, is, if it weren't for the wind blowing through the trees or the ocean or watching the pelicans fly overhead, um, it would be very uncomfortable for me. It's not like I relished to being in this isolated in the pandemic, but it's been tolerable.
Yeah, I know for us it's been the hummingbirds and the
Mm.
eagles and the sea lions. That's kind of been
Oh, whoa,
that's
wow.
that that
Aquatic mammals. Wow.
yeah,
Uh,
yeah. Well, we get out far enough, I think we'll actually get to see whales and dolphins, but we haven't been able to do that quite yet. But
we get to see dolphins swimming by, so that's
beautiful.
good.
I love it. Dr. Porges, where can people learn more of the work that you're doing? Where are the best place to send people to learn more of everything
So
about
we just created in the past few months the Polyvagal Institute, and the Polyvagal Institute is offering courses and continuing education on polyvagal theory. But the institute, which is polyvagalinstitute, one word.org, is really about creating a culture around polyvagal theory. So we have people in the judicial system developing courses, in business developing courses, in education, not just mental health. So I think your questions are right on, that polyvagal theory is not just about mental health. It's about living
mhm.
in the world that we're in, and how do we optimize that. And so you'll be able to see the courses being developed, and you get more information. I also have a personal webpage, and it's stephenporges.com. And there, the on the personal webpage, there's a link to integrated listing systems, which has the license of the technology and distributes the safe and sound protocol. And there'll be a new book coming out in beginning of September from Norton called Polyvagal Safety. And basically, it's about many of the things we've discussed.
Oh, that's wonderful. I look forward to seeing that. Wonderful. And I'll put links to all of those in the show notes so people know where to find your work. And
Great.
Dr. Porges, what an absolute pleasure. Thank you so much for your
Thank you.
time.
Thank you, Jason. Thank you for inviting me. Have a good day.
You too.